Hello, this is Dr. Tom Clark from the Center for Weight Loss Success. I'm a board-certified weight loss surgeon and bariatrician. Over the past 2 decades, I've helped thousands of people lose weight and keep it off for life. One of the more common questions that I get around weight loss surgery is, will I need to take vitamins and supplements? Good question. The short answer is yes. Okay, everyone really should take their vitamins. This doesn't matter whether you had surgery or didn't have surgery. But if you're interested in your health, if you're interested in losing weight or trying to lose weight, or if you're contemplating weight loss surgery or you've had weight loss surgery, absolutely you need to take your vitamins. Okay. So that's what I recommend for everyone. Now, which vitamins to take somewhat depends on your health, but it also depends on somewhat which operation you've had. So other supplements can be helpful, but not necessarily a requirement. Which vitamins are recommended somewhat depends on which surgery you're contemplating having. Because someone that's having a bypass type procedure, specifically a gastric bypass, may need to take a few extra things. But I'm going to go over a few generalities here. I do recommend people to use pharmaceutical grade vitamins as well as mineral supplements. And the reason being is that pharmaceutical grade vitamins undergo the strictest guidance. They're under really FDA conditions. They give you the best the best absorption and utilization. As many vitamins, you never know what's really in the bottle. Even if it says what it is on the label, it may not quite be right. So I do recommend using pharmaceutical grade vitamins. If you're interested from us, we have them in our e-store. The website is www.cfwls.com. But let's go over a few of what I recommend. All right, initially, and really just the most important thing is getting a good multivitamin. Now, right after surgery, I do recommend people use a chewable vitamin. And the reason is we're trying to keep what's heading through your small healing gastric pouch. We're kind of keep that to a minimum as far as pills go. And vitamin tablets typically are great big tablets. So initially using a chewable form is what I would recommend. Long term, it's absolutely fine to use a normal vitamin, not necessarily a chewable one. Now, I do recommend people take 2 a day during weight loss. Now, some people wonder, gee, is this going to be way too much? Well, no, this again wouldn't matter if you were not having surgery. If you're just in a weight loss plan, I recommend taking 2 a day. The RDA on a vitamin is the absolute minimum that will prevent a deficiency. Has nothing to do with what's an optimal dose. So it's incredibly hard to overdose on vitamins. Taking 2 a day definitely is only going to help you, not going to hurt you. B complex. B complex are all the B vitamins. Okay, there are 8 different B vitamins. B complex means it contains all of the B vitamins. B vitamins are often referred to as your energy vitamins. And the reason we say that is because they tend to make the energy producing equations run much more efficiently and effectively. So they don't actually give you the energy themselves. It makes those equations that produce the energy run better. So B vitamins are very important for muscle and nerve function and just your overall energy production. So I think just about everyone could benefit from B vitamins. Essential fatty acids, or EFAs, sometimes referred to as fish oils. Yeah, essential fatty acids, they're very important. I think everybody ought to take them. Doesn't matter whether you're in a weight loss plan or not a weight loss plan, but they're just good for you. They support the cardiovascular system, your brain, the nervous system, immune function. I also find that they tend to help with preventing constipation. And that's not really meant to be what it does, but it does tend to help that. It's almost a side effect of it, which potentially is a good side effect. Now, one of the last things I recommend most people ought to be on is magnesium, and often using it as a magnesium-potassium combination. But magnesium and potassium, essential to muscular and cardiovascular function. Most people don't get enough of this. Prevents and treats fatigue, also helps prevent muscle cramps, constipation, so it helps a lot of different things. And most people don't get nearly enough magnesium. We often hear about people taking extra potassium, but what often they really need is the extra magnesium. And it doesn't It doesn't necessarily show up in your blood test because very likely you're going to have a normal magnesium level. Potassium often drops down, but magnesium is almost always normal. But that doesn't mean you have enough in your muscles. So I encourage almost everyone ought to be on extra magnesium as well. So those are a few things that I definitely recommend. There are a few other things that potentially, depending on your situation, I would recommend as well. Now, if you want more, you'd like to receive our 21 free videos on the top questions you need to ask when considering weight loss surgery, go to our website here, www.myweightlosssurgerysuccess.com. If you're interested in learning more about the Center for Weight Loss Success, our corporate website is www.cfwls.com. Thanks for listening. We'll check you on the next video. Take care.